Okay, now there is the question of what to expect. Okay, so the most common question that comes to mind, and one that you should pose to your radiation oncologist, is what are the side effects? Now, when we're treating the breast with external beam radiation therapy, understand that beam has to originate externally and then go through the skin to treat the breast. Therefore, one of the most common side effects is actually a skin reaction. We refer to that as radiation dermatitis. Every time you see the word derm, it's skin, okay? And it can manifest as just erythema, which really means redness, okay? Now, with my skin, radiation will cause darkening of my skin in the area that's being treated. Now, it is very important to understand that radiation is focal or local treatment. That means that the side effects are associated with the area that's being treated and nowhere else, which means that if I'm treating the breast, you will not have any effects associated with the brain. And so, of course, when you are undergoing radiation therapy to the breast, you won't lose your hair, okay? Because all the side effects are focal, okay? Now, again, radiation dermatitis can manifest first as erythema, which is redness of the skin of the breast that we're treating, and sometimes it may actually peel like a sunburn. And we do have different regimens, either prescription or concoctions, that we prescribe to address any sunburns. In the meantime, prior to any development of sunburn, just erythema which is the first side effect in the realm or on the spectrum of radiation dermatitis, then we usually recommend a moisturizing cream applied to the breast liberally before you go to bed at night will suffice. Optimally twice daily, but some of my patients forget, so I relieve their anxiety by allowing them to apply it before they go to bed at night. Now, you want to pay attention to not just the breast, but also the inframammary fold, which really just means the crease underneath the breast, because that's prone, right? There's friction there. And also in the lateral aspect of the breast under the arm. Now, for some patients, we are actually treating the underarm. In medical terms, we call that the axilla. And when we treat that area, you also need to pay attention to applying the cream there as well. We usually use Aquaphor or Eucerin. Now, why would we treat the axilla? Now, if pathology shows that not only is the cancer present in the breast, but also in the nodes under the arm, the axillary nodes, we do need to treat that area. And in that scenario, we also treat what we call the supraclavicular nodal basin. What that means is literally supra, above the clavicle. So right here. Why? Not because it's involved, but because we know that if you have nodes under the arm, it can spread to the supraclavicular fossa. So here is the actual spread pattern: breast, axilla, supraclav, okay, supraclavicular fossa. So we treat this entire area if a patient presents with nodes positive. And in that case, the Y is not just a decrease in local recurrence, it's also an increase in your chance of survival. So why do we treat this entire area? If you present with positive nodes in the axilla, it not only decreases the chance of the tumor coming back, but it also increases your lifespan. Okay, so we've answered why, how, and we've also answered what. Radiation dermatitis, skin side effects. Now, there are also other side effects. For example, some of my patients do develop edema, which is just swelling of the breast. So when you think of itis, you think of inflammation. And when you think of inflammation, think of red, think of swelling, and think of tenderness. So all those side effects can occur when we treat the breast. Another side effect that occurs in about, I would say 25% of my patients is folliculitis. Now, what is that? Remember I said itis refers to inflammation. Now, regardless of where we're treating on the body, there is hair there, okay? And if you can't see the hair, they're hair follicles. And so sometimes the follicles can become inflamed. Thus the term folliculitis. Now, how does folliculitis manifest? It manifests as a skin rash that is pruritic. That's a medical term which simply means itchy.